I'll take a leave now. I'll go to the
First,
tomorrow.
advance
8
congratulate
o'clock, we have a Ganesh
all
meeting. And evening 6:30
students
service coming.
who are receiving or hoping to receive a good results from CET cell.
And we have a BLD now bids.
I am representing BLD Sri Sangrapso Mahaswamiji College of Pharmacy and Research Center, Mysore. I am Dr. R.P. Kotna, principal.
उधर ही कर सर हाँ ये एडमिशन सर यस सर वहाँ में एक ओपनिंग करा है कोल्हापुर दिखा है ये भी अभी लगा रहा है put some chair and
So you can see a beautiful building and a holy blessings of Sri Swamiji. I begin with my journey, the college journey, which crossed 38 years of its legacy in giving a quality education in its region. BLD Association started D Pharma College in the year 1981-82 and upgraded to bachelor degree, that is B Pharma, in 92-93. Later on in 2007-8 we introduced PG programs. Then one more program in 9-10 we introduced community program. Later on many PG programs have been introduced in 92. Recently we got accredited by NAC PG programs. This is only one college in the northern Karnataka affiliated to Rajasthan University, got a certificate of accreditation by NAC. With this, I begin to talk about courses offered at the institute, and although the duration of courses, the content of courses, and a possible placement of these courses. As I came across several questions by parents, students, and their guardians regarding the prospectus of pharmacy course. I discuss with you, parents and students, in all languages, English, Kannada, and Hindi, because as I understand, all over the country, the northern part, eastern part, and south part of this country and western part are listening to our live YouTube channel for the benefit of all. So I request to bear my language if I talk in a Hindi and English and Kannada also. जैसे कि आप जानते हैं, pharmacy is becoming a hot cake nowadays. In this COVID-19 situation, many countries were looking at India for the medicine to supply for their country. And somebody says, India is the world pharmacy, जहाँ सबसे ज़्यादा मेडिसिन उत्पादन करते हैं, उसके ऊपर रिसर्च चलता है, and we are leading in manufacturing of medicines and supplying to all over the world. With this, I can say the BLD Association has took a right decision in 1982 to establish a pharmacy course for the aspirants. We have a D Pharma course, that is a diploma in pharmacy, that is for 2 years, and another course, Bachelor of Pharmacy, that is a B Pharma course. It is a 4-year course. Then I formed a newly introduced course, which is a 6 years course, and it is a integrated postgraduate course. Then we have M-Pharma course, that is a Master of Pharmacy, PG course, that is a 2 years. We do have a PhD programs in different branches like pharmaceutical chemistry, pharmaceutics, pharmacology, and pharmacognosy. We do offer value-added courses jointly with DLD deemed to be university. So after completion of 10 plus 2 or a PUC in a science stream, physics, chemistry and biology, or physics, chemistry or mathematics, you can take admission to diploma in pharmacy, for which the prospectus is community pharmacist. You can also go for a bachelor in pharmacy, that is B Pharma. Again, you have an opportunity to serve as a community pharmacist in a government sector drug inspector, and you can move on to the drug manufacturing sector as an executive or a product manager. You can also opt for a doctor of pharmacy, that is a PharmD. There are plenty of opportunities after completion of PharmD course, that is a clinical pharmacist, hospital pharmacist, physician's assistant, pharmaceutical care taker, and medication management. Many more opportunities are there in a doctor of pharmacy course. Actually, the B Pharma and M Pharma course are research and development and industry oriented courses, whereas Doctor of Pharmacy or a PharmD is a clinical oriented course. For all these courses, say diploma in pharmacy, bachelor in pharmacy, and doctor of pharmacy, you need to have a 10 plus 2 or a PUC with a science stream, having studied physics, chemistry, and biology, or physics, chemistry, and mathematics. After completion of these courses, we have seen there are plenty of opportunities in India as well as abroad. India is now recognized, as I said, world's pharmacy. Every third pill consumed in any part of the world is manufactured in India. That I should be, or all of us should be proud of that statement. We have very well dedicated, experienced faculty who can shape your future, who can groom your career. We have 6 departments, PG programs: Department of Pharmacology, Department of Pharmaceutics, Department of Pharmacognosy, Department of Pharmaceutical Chemistry, and Department of Quality Assurance, and Department of Pharmacy Practice. So all these departments are postgraduate departments, basically developed on the overall knowledge of undergraduation and specialization in department wise. So as I said, the pharmacology deals with the finding out the mechanism of a drug or activity of a drug. Pharmaceutical chemistry deals with the manufacturing of new drug molecules. Pharmacognosy deals with the development of herbal formulations. Pharmaceutical quality assurance deals with the regulatory affairs and quality assurance management system. And pharmacy practice is dedicated to the clinical orientation, and where the medication management or pharmacovigilance or pharmacoeconomic studies have been taught in the pharmacy practice department. And pharmaceutics is a one which designs and develops modern or drug delivery systems, advanced drug delivery systems. So we have a very treasure of knowledge, a library, good stock of books, around 7,800 books are there, around 1,673 titles, and various e-journals are available, bound journals are available, and a spacious library is there for studying environment all the time. And we have very well equipped classrooms. So nowadays, all are focusing at online teaching, or already we are equipped with the online teaching modules at our classrooms, and they are now running with online teaching. And we have ultra modern laboratories for all departments. Students can have enjoyably and very meticulously they can learn the practicals, which is more essential for pharmacy course, because it is a practical oriented course or a skill based course. So along with our curricular aspects, we also emphasize on research, mentoring, and holistic learning. Let me come to the research part. We have received around 2 crores of research grant from various funding agencies like ICMR, BGST, RGHS, etc. And we have produced out of it 450 plus publications and patents. Mentoring system is in place. We have dual mentoring system. One is through teachers and another one is through senior students. So this is one of the new unique kind we are practicing at our institute so that every student is addressed and nobody is out of the sea. Everybody come into the mentoring system and everybody's problems are solved so that the students study is enhanced in all the way. Then we have holistic learning. Holistic learning is achieved through the development of medicinal plant garden. We have planted around 100 species of various medicinal plants. We teach students their harvesting, their cultivation, and their use and their marketing also. And we have field visits for community services, and we have adopted a village wherein our students for every month visit the village and take stock of the health condition and advice for the medication management at village levels. As I said, our institution is mainly focusing on research activities. We have research collaborations with Lublin University, Poland, Debre Behran University, Ethiopia, and various academic institutions in and around Karnataka. And we have very good understanding with BLD universities, hospital, where our pharmacy programs and pharmacy practice departments are running. Our students are studying there. And we have carried out several research activities in collaboration with RL Fine Chemicals Bangalore, where our students are deputed to carry out their research work and they produce a very good research and the papers are available in the online mode. And we have received, I said, research grant from RGHS, that is Rajiv Gandhi University of Health Sciences, Indian Council for Medical Research, Vision Group of Science and Technology, that is Government of Karnataka. We have Industry Institute interface. We have established startups centers, incubation centers. We encourage our students for entrepreneurship. We give regularly training for entrepreneurship during their course of study. And we have a social responsibility too. As a college or as an institute, we have social responsibility too. During a COVID situation, during lockdown 1 and 2, everybody knows it's a dangerousness. So we manufactured around 3,000 liters of hand sanitizer in collaboration with a local distillery, and we distributed free of cost to the district administration for the usage. They have used at their government hospitals, police departments, and other departments which were in place for the prevention of COVID-19 pandemic. And we sprayed a hand sanitizer. You might have come across our this program. We sprayed a hand sanitizer to PUC students, those who were writing English paper on 18th of March, and it was around, we covered 11,000 students on that day, and we sprayed or we sanitized all the students while going into the examination hall. We have scholarships and concession for meritorious students. We facilitate to avail a scholarship from Government of Karnataka, like Vidyasri scholarship and other scholarships from the social backward departments and minority departments. And we also offer, the management offers fee concession for meritorious students too. We have very good placement cell. That is one of the important component of every institute where they produce graduates. then they should place them in a right position. So after graduation of our students are placed in a well-reputed companies which are leading manufacturers of pharmaceutical products. And we have a placement through campus also. Nowadays, the placements are offered through online or Skype meetings. And also encourage them to opt for higher education. Those who complete graduation, those complete a diploma in pharmacy, we encourage them to go for B Pharma. Those complete B Pharma, we encourage them go to M Pharma so that their studies is completed without any break. Then we have very good alumni network that plays very important role in placement of our students in different parts of the country and abroad. We have huge network of alumni working in various sectors in India and abroad. Industries and R&D. They are working in industries, they are working in R&D departments, they are working in vigilance, they are working in clinics, they are in corporate hospitals, everywhere, in all sectors of the healthcare sectors, our students are working and they are in touch with college all the time, and they are very proud to be associated with our institute and ready to help their juniors for architecting their career. Apart from our educational or academic facilities, we too have other facilities like we have swimming pool in our campus, we have multi-gym, we have indoor and outdoor stadiums, hostels are there for boys and girls separately, and we have cafeteria, we have SBI bank, the ATM and CDM, we have post office and auditorium which is very near to our college. So with this background, I wish all a great success for the future, and pharmacy course is a very grooming course in these days. Already the admissions are started, many queries are there, and we have very limited seat. For example, for a D Pharma we have only 60 seats. Out of 60, 48 seats are management quota and 12 seats are from government program. For B Pharma, we are having 100 seats. Out of these, 70 seats or 80 seats are with management quota and 20 seats for government or CET quota. Again, for Form D, we have only 30 seats. For them, 15 seats are management seats and 15 seats are government or CET quota. So with this, with this, with this, I complete my talk saying that admissions are open for academic year 2021. A bright future is awaiting for you all. You can join D Pharma course, which is for 2 years, B Pharma course, which is for 4 years, and Pharm D course, which is for 6 years. And there are helplines. You can take a screenshot of this video, and you can also log on to www.bldapharmacy.ac.in. Every information is available in that website. Or else, if you want to have any queries, you can drop a mail, that is bldacop@yahoo.com or principal.cop@blda.org. So thank you very much.